there, my name is Shanna Dethi and I'm here at the Digital Health Live Studio at CES. I have with me Dr. Jeffrey Cummings. He's an MD and a Doctorate of Science, correct?
That's correct.
And a neurologist with
Yes.
the Cleveland Clinic. So you were just speaking with a panel on Alzheimer's disease. So why don't you tell me a little bit about what is new and new discoveries and what you're really hoping to accomplish today?
Well, Shannon, what we have are 5.5 million victims of Alzheimer's disease in the United States today. We're making progress on developing new therapies, but those new therapies are a decade or more away. So we have to be disruptive in using technology to care for patients now. And what we did in our panel was to invite all of the great inventors and the great minds that are here to think about all the solutions that can be brought to bear on the Alzheimer's disease journey.
Right, and this isn't just about caring for people with Alzheimer's, right? We're looking for a cure, right? We're not looking for a way, well, we obviously want a way to care for the millions and millions and millions of people that we're expecting as the boomers continue to age to get, but we'd really like a cure, correct?
We would love a cure, and of course we're working on those kinds of technologies as well. We have new kinds of brain imaging that are showing us the biology of the disease in a way that we've never seen before. We can see the biology and how the impact of our medications is beginning to work on that biology. But the emphasis on the panel really was, what can we do now? Those drugs are still a few years away, and we want to know how can we help patients now using the kind of technological expertise that is present at this meeting.
So it's really it was a lot about caregiving then,
It was a lot about how do you remind patients in the early phases when it's just a memory problem? How do you help caregivers when they're faced with the challenge of the increasing dependency? How do we help patients stay at home longer through smart homes,
right.
Through integrated technological solutions that will allow them to enjoy the dignity and the benefits of their remaining cognitive resources?
So having been in this field for a long time and probably you've seen lots of patients with Alzheimer's, what do you think as a physician is the toughest challenges you face?
Jenna, I think that caregivers face so many milestone moments. We know, for example, that when the patient suddenly forgets who they are, they suddenly think that their daughter is their mother or that their wife is their sister. Those are heartbreaking moments for our caregivers. Also, of course, when people begin to lose critical functions or when they have behavioral disturbances, these are some of the most tough moments in the life of the Alzheimer patient. And we really think that with technologies we can intervene in a way that would delay many of these milestone moments that make it impossible for patients to care at home.
Wonderful. Well, thank you very much, Dr. Cummings, for coming and speaking to us today. Thank you very much for participating in the panel, the Digital Health Summit. I know we were happy to have you there, and I'm sure Jill was really thrilled. So thank you again, and have a great day.
Thank you.